Hey everyone. It's no secret today that the healthcare industry is highly dysfunctional. But there was a time in the US during the late 1800s and early 1900s that even hated minority groups who were victims of racism and perhaps didn't even speak the English language had access to cheap, high-quality healthcare, high quality for the time, of course, and it cost them about $2 to cover an entire year's worth of medical care. This was made possible by what was known as fraternal societies or lodges. Fraternal societies usually looked like this. A group of minorities would organize into the fraternal society where they would voluntarily pool their money and resources and contract out to doctors. The contracts that these fraternal societies would offer would then undergo highly competitive bidding by many doctors. This made sure that prices were extremely low for each member of the fraternal society. As I said before, it was a meager $2 per year for coverage. Eventually, many of those at the higher echelon within the medical community got sick of this. They couldn't stomach seeing medical professionals supposedly degrade themselves by trying to underbid other doctors in order to get a contract from the lowly common man, or worse yet, pleading with disliked minority groups for their business. They thought those that within the medical community should be above groveling in such a manner. They also did not like the lower prices that members of these fraternal societies were benefiting from. A market that provides low prices means that their already soaring incomes are lower as well. There would have been nothing they could have done about this, but lucky for them, they knew precisely where to go to cause accessibility to become lower and for prices to become higher: the government. And that's exactly what they did. The government granted the AMA, American Medical Association, licensing rights, which limited the supply of doctors within the US. This naturally curved prices upwards. These government-granted powers also allowed the American Medical Association to deny doctors special hospital privileges or deny them licenses altogether to practice medicine if they dared to enter into a contract with a fraternal society. Fraternal societies were a fantastic illustration of the free market overcoming abject poverty, racism, and prejudice. The market didn't care what color you were, what religion you were, what your ethnicity was, or what social class you were a member of. If you could afford $2 a year, then all the doctors within these markets cared about was providing you a great service for an unbelievably low price, and at the same time receiving a lucrative contract to provide health services to the lowly tradesmen and the lowly common folk. You can thank the collusion between well-connected medical professionals and the almighty government for destroying those great organizations. In the spirit of healthcare, I'll put it this way: fraternal societies were an enormously healthy and beneficial part of the common man's life. And the government, acting as the virus that it is, infected it and brought it down, collapsing to its knees. In a nutshell, we already had an answer to the healthcare issues we face today, but government made sure it died a tragic, painful death. Alright, I'm done. Bye.